Fibroid. It is it is the most common benign tumor of uterus, also known as leiomyoma. They are smooth muscle tumor originating from myometrium. Histologically, tumor is composed of smooth muscle and fibrous connective tissue. Fibroid is an estrogen and progesterone dependent tumor. Major growth of fibroid occurs in reproductive age 30 to 40 years. Etiology unknown, but hormone like estrogen and progesterone, family history, risk factors like obesity, reproductive age 30 to 40 years, early menarche, nulliparous, and POS. This is risk factors. Types of fibroids. Two types: uterine and extrauterine. Uterines are three types. Then within myometrium called intramural or interstitial. Second is when growth towards uterine cavity called as submucous fibroid. And third one is when growth towards peritoneal cavity called subserosal fibroid. Classification by FIBO. Type 1, type 0, 1, 2 is submucosal. Type 3 and 4 intramural. 5, 6, 7 subserosal. 8 extra uterine. This is classification of fibroid by FICO. Now, symptoms. Most common, menorrhagia. Others, pain, infertility, and bladder symptoms. Like if posterior fibroid, it is cause constipation. If anterior, urinary frequency. Also, degeneration. Types of degeneration like hyaline, calcific, cystic, lupite, and necrotic. And now diagnosis. First, symptoms like general examination. Second, gynecological examination, like you can see tumor more than 14 weeks, uterus size, on palpation, frame, and restricted mobility. Third is pelvic examination. In bimanual examination reveals uterus irregularly enlarged by swelling felt per abdomen. Investigation of choice, ultrasound. Investigation of choice is ultrasound. Fourth, MRI. Fifth, also laparoscopy. Hysteroscopy. And last one, SCG, hysterosalpinography. Now, what is the management for fibroid? Management treatment. Management is symptomatic. For NSAIDs, decrease pain and bleeding. Second, tranexamic acid, decrease bleeding. Third, GnRH analogs like leuprolide and casorelane. It decrease the size and vascularity of fibroid. Fourth is GnRH antagonist. Antagonists like citrorelix and gandiolix. We also give like mifepristone for anti-growth. And last one is ulipristal. If patient has anemia, we have to give vitamin plus iron tablet. Which drug used to minimize blood loss? First is anti-progesterone. Second is anti-gonadotropins. Third is GnRH analogs. Fourth is LNG IS. Fourth is SPRMs. Selective progesterone receptor modulators. How surgical treatments, surgical managements by myomectomy like and laparotomy, laparoscopy and hysteroscopy. Also, we can do embolotherapy like laparoscopic uterine artery ligation. Laparoscopy uterine artery ligation. Myolysis and endometrial ablation and hysterectomy. We can also go for uh, what's the indication for emergency surgery. First, if torsion of subserous pedunculated fibroid. Second, massive intraperitoneal hemorrhage. Following rupture of veins over subserous fibroid, or third is uncontrolled infection, or maybe uncontrolled bleeding.